Doctors are weighing in after the Centers for Disease Control and Prevention revised the childhood vaccine schedule at the recommendation of the U.S. Department of Health and Human Services. Officials reducing the number of vaccines recommended for all children from 17 down to 11. Dr. Jeffrey Jerry, an infectious disease specialist with St. Luke's University Health Network, says he's not opposed to changing the schedules, but does have some concerns.
I am not against us taking a look at the way vaccines are given, changing some of the schedules. Not everything that was recommended is wrong, by the way, but some of these things are. And the problem is that they ended up going around what would have been a better way of coming up with a conclusion that would have served us better.
The recently removed universal recommendations include flu, COVID-19, rotavirus, hepatitis A and B, meningitis, and RSV. Those shots are now only recommended for high-risk children. Officials say the updated changes were modeled after the country of Denmark. Dr. Jerry says there are several reasons why the U.S. and Denmark can't be compared, including obesity rates, entirely different systems of insurance coverage, and overall population size.
The United States has a population of over 340 million people. Denmark has a population of roughly 6 million people, which for all practical purposes is the size of Wisconsin.
Those in the medical field are raising concerns with these changes during a time when illnesses like the flu are spiking at record numbers early on in the season.
We also know that children, even when they do well with the flu as a disease, that they are also the center of the way it spreads to others who won't do as well. And that would be senior citizens, those with underlying disease, as an example.
Doctors recommend talking to your healthcare provider to determine appropriate vaccinations for your children. Emily Kress, Newswatch 16.